Step into Your Life with Julianne Williams. I am very interested today in this episode, even for myself, and I hope that you are too. It's something that's really important. I have my friend and colleague, Cheryl Field, here with me today. She has written a book called Prepared, a healthcare guide for aging adults. It's really important. I worked in the skilled nursing profession for over 30 years. And every time someone was in crisis, they would give me a call, and actually they still do. But what I learned from it is that it's a really difficult time when you have an older parent or relative that needs health care. Cheryl is a clinician, and that's what makes her book so special. And she has also worked in long-term care and healthcare for many years, and she'll explain her background in just a moment. But today, I think we need to elevate the conversation about how do we prepare for not only our healthcare needs, but the healthcare needs of our loved ones, so that when the time comes, we're prepared and we can give the best experience possible during that time of need. And Cheryl has again written this book that I think is a must buy for anybody who's over the age of 40. And it will help you think about what comes next. So with that, let me turn it over to my friend and colleague, Cheryl Field, so she can tell us about herself and you can get to know her.
Yeah, thanks, Julianne. Welcome, everyone. As Julianne said, my name is Cheryl Field. I'm a master's prepared nurse. I spent 35 years formally in the nursing curriculum. But as I was reflecting and thinking about this book and sharing with stories with colleagues, I was first sitting with my neighbor, who I now know, had Parkinson's dementia, when I was 10 years old. Wow. And I would sit with her for like an hour and a half, while her sister would go and do the grocery shopping. Oh. And then later in my high school, I worked actually, on taking care of a gentleman who lived at home with me and had a stroke. And it was close to my high school. So I was able to walk after school and sit with him and then return to school on Monday morning. So I've really been in senior care and advocating for adults in older years, really since I was a young girl. And I think it's just part of my stitch, my soul. It's really, really who I am. Yes. And so it's really a treat for me to spend time with you. Thank you for having me. It's such an important conversation. I'm so passionate about it. And as you mentioned, prepared, we think about how do we get ready for a change in health for any of us, right? Myself in my 50s or later, my parents, we don't want to think about a sudden change in health. And yet each one of us really should be prepared for that moment. So the need to, think about what documentation, think about advanced directives, keeping track of our own medications, our pain assessments, our activities of daily living. Just having that information is really essential before you enter, a healthcare system. And I know in the opening comments, we talked about how we worked in the nursing home space. There's so much change happening with where you received care. Yes. And this book really doesn't focus on any one location as a requirement. It starts talking about, okay, a change has occurred, and now maybe you're going to enter the system through the emergency space. But what's going to happen in that space, and how quickly will you be really transitioned from an emergency space to maybe receiving care in a hospital or moving you home with home services? Some folks need a rehab stay or skilled nursing stay. Others may need a little bit of a longer stay before getting back home. But ultimately, the book is really helping people to move from a place of health through that acute illness, even if it's a little longer, and then back to that place of health where we think about ourselves as being balanced and happy in whatever you call home. Right? Because home can be lots of different places, for lots of different people. So the motivations, for me, in putting it all in writing, right? Writing this book, spending the time, goes back to what you talked about. As an expert in the space, I'm often the person that gets the phone call and love to do it.
Yes.
I found that I just I couldn't do it fast enough. There were members of your family, your friends, and extended families who needed that kind of guidance and advice. And throughout my career, I've given it willingly. I've learned from it. But it was when you see what caregivers and advocates go through from that perspective, that's for me really where the unique perspective and the lessons started to come from. So, I had worked many years in the space, and then when I saw what family members went through, what advocates went through, who came into that without the education, without being prepared, without a system, I began writing. That's when I really wanted to pull together my lessons learned and share that with everyone, because I there weren't enough hours in the day to be on phones.
There aren't.
And yet this kind of content with humans aging at a pace faster than ever before really becomes beneficial.
It does. And, I didn't mention that your book is an international best-selling book. And I'm so happy for you. Congratulations. But that also shows that people are wanting and needing assistance to figure out what to do when something happens. So I thought what we could do, because I'm a nursing home person and it's just something that is so near and dear to me. But the questions I always get is, how do you choose a nursing home or assisted living facility for that matter? So we can maybe explain the difference and say, how do you choose that center if you need it? And what are all the things they can do? Because there's also, I think, a lot of myths about what happens in a nursing facility. I know even my parents used to say to me, because when I started, we still called them convalescent homes. They would say, is everybody resting? And it's like, no, actually nobody's resting. They're like busy. They're in activities, if they're living with us and creating a life, or they're in physical therapy and speech therapy, occupational therapy, and getting their mobility back so they can go back home or back to the assisted living facility or whatever it is, or stay with us at the nursing facility and have a more robust life. So maybe you could talk with us a little about some of the advice, and I know I have some, but I want yours first because you're the clinician and you are the author. What would you do if today you needed to help someone or yourself or your family member find the right skilled nursing facility or assisted living facility?
That's a great question. And so I'm going to address a couple of the things that you talked about there. So first of all, you're right that this publication has been promoted in 13 countries, and that's because what we're really talking about are human conditions. And every human in the world has their health, and when they don't have their health, they want it back. And we think about that as a sense of balance and homeostasis, and how do we achieve that healthy outcome. So these concepts are universal. And while we in the United States market might refer to it as, a convalescent or skilled nursing, if we really step back and think about that human and what that human is trying to regain, they've had a change in health.
Right.
And so now to answer your question, I've had a change in health and I'm in the US market and I'm thinking that I need continued assistance. Where would I go to look for those kinds of services? As I think those locations are changing, and to your point, the capacity of those providers and the missions are also changing. So my first recommendation is to start big and then get small. Care.com. We can go right to our carecompare.com that the United States government sponsors and places information about all kinds of providers, not just nursing homes, assisted living, home care, physicians. When you go to care.com, you'll be able to see, or carecompare.com,
right.
You'll be able to see a variety of providers that you might be looking for. Those reports and those metrics are really big numbers. They're looking at specifically when inspectors come to the building, what kind of concerns or do they find? They're looking at some staffing, how much staff for facilities had, again, over time, big numbers. And they're looking at outcomes of quality and care, big numbers. Those big numbers, they may not actually tell the story about your loved one.
I am so glad you're bringing this up, because I mean, it is important. It's an important screening tool.
Yes.
But boy, there's so much more that goes into it than a rating.
Correct. So that's why I say start big and work your way down. That's oftentimes where you and I get a phone call, because the next step is, we'll get the reputation. Is there anyone you know who's had a loved one in that center?
Right.
Oftentimes, care providers, they have a reputation, right?
Right.
We've heard about good things. And those are great conversations to have, keeping in mind that the needs of your loved one may be very different than their loved one's needs.
Very good point.
I also recommend that folks get in their cars and go take a tour. A big part of Prepared talks about advocacy, it's all about behavior that you as the patient or your loved one is going to take towards ownership of your health outcomes.
Right.
So this is your health. You've had a change, you're off balance, and you want to regain that balance. And do that by leveraging providers in your space. Leveraging a skilled nursing provider, again, for those skills that they can provide. You've had a physical change and you need to relearn some old habits. You need to learn how to do something differently. Physical therapy, occupational therapy, speech, great for that. Those are great skills to leverage. Getting in your car and going to have a tour of that location, talking to the humans that run the building, right? The yous of the world, the me's of the world. These are folks who are in charge of the operations. And in the book, you'll actually learn, in the United States market, what they're called, what they're responsible for. So it gives you an insider track. Really kind of being able to, almost like a map, right? It's just helping you navigate that system, know who you're going to ask for, what's the title of that person, what they generally do, what they're responsible for. By meeting and taking that tour and explaining what your loved one's needs are and hearing how they programmatically address those needs, then I think you can make a good decision. Now, of course, there's other components that go into where you might want your loved one placed versus operators, that if there's an available bed and if your insurance carrier will actually pay, to place that person. But I do recommend that, you start big, get the data, look online, and you can read, those through some of those survey findings. I think what's interesting about the information that is available publicly, or what's lacking, if you will, are the cards and letters and thank you notes. So none of that ever makes it into our consumer reports, if you will, and that measurement system. So that's why I say you got to go to the next level, because what you see online is only going to be part of the story of that facility. And there are really compelling pieces of those systems that make it hard to earn 5 stars, for example. It's really hard to be a 5-star facility, and yet you and I we'd want to go to a 5-star restaurant, and we might look at a 2-star and think, oh, I'm not going to go to a 2-star restaurant when there's a 5-star restaurant across the street. But there's a lot of really great 2-star providers who could meet the needs of your loved one exceptionally well.
That's right.
So I read a little closely into, maybe areas of quality that they weren't doing well in the prior year. And if it's nothing to do with my loved one, hey, they may be great at what your loved one needs. So look a little deeper into some of that big data in making those choices.
And I think too, having been the person who was the lead of a nursing home, and then obviously a very large nursing home portfolio, there are some things that when you do get in your car and go, that I think it's the stuff that matters. So yes, the star rating is important, and it could be that where you're located, you just can't get enough RNs because it's a rural area, and so unfortunately that affects your star rating. But you've got amazing LPNs and CNAs that work under the RN and the physicians that are on site and seeing the residents there, and that will change your star rating. And in the end, the care is still excellent.
That's right.
The other thing is that there's just common sense things for us to consider when we're looking at a nursing facility or assisted living. When you walk in, are people friendly? Are you greeted? And not every facility is very large where they have a reception desk and all of that. Sometimes you have to walk to the nurse's station, but if they're kind in greeting you, is there a smell? There will be smells at certain parts of the day when people are engaging in their activities of daily living, just like when you're at home and you get up and use the bathroom and brush your teeth and do all of that in the morning. That's just normal. But you've got a lot of people in a space.
Yeah.
But if at 3 p.m. there's still a pervasive odor, that's something to consider. Does it look clean? Visit at a mealtime and see what the food looks like. Just those things, so you can get a good feel. Are there activities, and are the residents there? Or if it's a more rehabilitation-centered facility, is the therapy room open at 4 p.m. and is it busy? To me, those are some of the things that I would look at if I was helping someone. That's what I would do if I toured a nursing facility I did not know.
You're absolutely right. And I think sometimes what we don't see, like you said, when you get in the car, what you go, what you don't see is the vibe, right?
Yes.
The closure, the feel. Like you said, we can't count smiles and put it on the internet,
right.
But wouldn't it be great if you can feel that? It starts from leadership, and it's pervasive in the facility. There's also a lot of wonderful humans who come to work in these facilities,
yes.
in alternate roles.
That's right.
That actually make the difference.
That's
I will
right.
tell you,
Agreed.
On the cover of Prepared is actually a family member, and she, that's my aunt, Marguerite, we call her Chum. She adored the food service director at her assisted living.
Yes.
Why? Because 3 years before she had driven the Meals on Wheels van. So we imagine we go on a tour, and we're going on a tour, which is a really, it's what I just said to do, but it's actually emotional.
Yeah.
And it's a little tough because you're like, oh, I'm coming to pick a place where I'm going to stay for some extended rehab, and she thought maybe she'd need to look beyond. And so fear, right? She's almost looking trepidation. She almost didn't want to see anything that she liked, right? She just didn't like the whole idea. And here's this face of this friendly face of a woman that she remembers knowing. We didn't go 2 minutes past that part of the tour. She's like, this is where I'm going to stay. I want to come here, because she knew someone and they had that friendly face. And then, of course, the bonding that they shared over her time together, and the facility. And they did this for everyone, but she felt it was so personal. And they went out of their way to make sure that everyone felt that personalization around mealtime, and that she had exactly the kinds of food she liked to eat, which every family member and patient receives. And I thought one of the nicest touches were, because we had come and taken a tour and had spent a little bit of time at interview, they sent us home with a goodie bag, a little to-go bag of actual dinner from Tulare,
nice.
which was a great way for us to sample and taste the meals. To your point, look at what the food looks like, but also was really quite empathetic to the reality that our day was busy, and now we were going to go home and we already had a meal prepared. And so it was really quite lovely. And so these are things that happen to us again. It's those little things that you'll see when you go and take the tour. Look with your
and that's a next level amenity, by the way, right there for someone who comes to visit.
Yeah, somebody was really wonderful. So those are, again, like you mentioned, things that I think about. And if you're looking to go into a facility for short term, short stay rehab, a lot of times those units are separate and segregated from long-term convalescent facilities. And so ask those questions, when you're going in. Where might my loved one be staying or sleeping? Also, you can ask those same kinds of referral questions to, a trusted physician who knows the market as well. The other thing I just to talk a little bit about in Prepared is what to expect. And I think that when you're having a change in health, you want to get back to that healthy homeostatic state. And there's a lot of emotion. I call it frustration. Most of the time, that's the word that comes from me is I'm frustrated.
Yes.
When I'm not moving to where I want to be quick enough.
Right.
And so expect that.
Right.
Just know up front, you're in a time in your life where it's going to be a bit emotional and a bit frustrating. Give yourself some grace. Give your partners some grace, and not take your frustration out on the humans who came to work in the provider setting where you're receiving care. And I do talk a lot about accountability, in the book, like owning it. This is yours.
Yes.
And so,
which I like, because we're not powerless in our care. I believe that sometimes we feel that we are because it's so complicated now, which is why this book is so important, because it's so complicated now that what it does is it sort of takes the wind out of your sails, that you just have to kind of go along with what the insurance company tells me or what the physician tells me or what, that kind of thing. And in your book, what you really talk about is how do I get into the front of this? How do I get really where I'm in charge?
Yeah.
And you can be in charge. I also, and I want to talk a little bit about that part. I also would really like to talk about, as a family member, some of the feelings that you have and how we can handle our guilt, our sadness, our fear. And then also when we have a lot of family members that are involved, how can we make this the most seamless experience for everyone so that we're focused on the well-being of our loved one as opposed to other things that are out there?
Mm-hmm. Okay, so great couple of points there that we'll talk about. So I think I'll start first with family.
Okay.
So we mentioned it's emotional time.
Yes.
And you're absolutely correct. This is a great time in our life to advocate and take control. I want families to remember that they represent either the loved one or the patient. And it's really three people working together in this partnership. There is a payer, and that payer does care about your health outcomes. They also want to see that you care about your health outcomes as a patient or as a loved one, right? What are you doing to learn your diet restrictions, to learn about your diabetes? Do you really want a better health outcome? It's not going to just be something someone gives you, right? You don't just automatically get a better health outcome. Sometimes we really have to work for them. And the payer will work with you on that. So we talk about our insurance companies.
Mm-hmm.
We need to understand their role in the game.
Right.
Same thing with providers. You can leverage their education, their expertise, their suggestions, but at the end of the day, when you're deciding what to eat, check your blood sugar, follow your program, those are choices you make around your own accountability for your own health outcome.
Right.
And so those three work together. Families have to remember that what they want for their loved one may not be the loved one wants for themselves.
That does.
So that's a type of
does
friction, right? Where they're the family can be upset at the provider that they haven't convinced their family member to make a different choice, to be more compliant with the program.
Correct.
So that's a whole separate conversation. What I do talk about in the book, and from an advocacy perspective, access to information for me is the most frustrating part of having a loved one in a healthcare system. I'm so spoiled with we text, we do all of these things with technology. Why should I be waiting for a call back from a very busy human to see if mom or dad ate today or had their pain medicine or moved their bowels? If I can look that up in a family portal and get an answer to the question, my emotion comes down. Right. I'm less frustrated. I have had a chance to look in on a loved one. And you talked about that guilt. A lot of you as advocates are sandwiched between your little children, your aging parents, and not for nothing, you're the height of your career, where you're supposed to be performing at a very high level at work. That's hard to do.
It is.
And if you fall into bed at 10:30 at night, right? Everyone's finally got to bed and homework and this and that's done, and you're like, oh, I never got that call back from the hospital. Now, if I have a family portal, I get out of bed, I log in, I look at these things, my guilt comes down. My fear comes down. Information to a family member can really reduce that emotion and the anxiety.
How many centers now in healthcare have those portals? Because that's something that's fairly new.
It's changing,
especially in the long-term care space, right?
Correct. So ask. And that's why I say to ask, because there's access to information rules and regulations that make those portals what technology companies are investing in. So I always say ask. And the minute we finish this interview, it'll change tomorrow.
True, that is so true.
So it's a great question to ask. If you can't have instant information. You can have scheduled information.
Mm-hmm.
I'm going to call every day, and I'd like to speak with someone. I'd like to ask these questions. What's a good time? What's a good medium? Set up a consistent time. And you may be talking with a unit secretary, which is fine.
Mm-hmm.
And the nurse has prepared content, for that person.
Mm-hmm.
If you can visit in person, ask those questions. But I know, as again, the person we're talking about is sandwiched between children, career, and supporting parents, really hard to get there. The other part of the partnership for families, choose one person as a lead communicator. In your family, if there's someone like you or I who's a nurse, we tend to be that one lead communicator.
Right.
But in a partnership with your provider, you can't have every sibling calling in and having 6 scheduled calls in the morning to get an update on mom or dad.
Mm-hmm.
Sometimes that's a conflict amongst siblings, right? And I tell them,
and that's what I was going to ask.
Figure it out.
So what do you do? Like, how do you handle that? Or what is your suggestion when people disagree? Just in terms of having that point of contact, because, I've found in my many years in my career of helping people in this phase of their life that sometimes we do have siblings that are not on the same page, and that's okay. It's not a judgment.
Sure.
However, when you're the provider and you are trying to work with families, the person that actually suffers is your loved one.
That's right. So going back to chapter 1, right, first part of the book, being prepared. Have those conversations and agree to disagree, and have the patient, the mom or dad, say, you know what? Again, I have 4 kids, love you all. In this instance, this is going to be my advocate. Who's going to speak for me under, medical power of attorney? These kinds of conversations, having them outside of the also craziness of health change.
Right.
So that's part of getting ready. Now, maybe you haven't done that, and now you're in the throes of it.
Right.
And so I think going back to that patient, because you're right, it's the patient that suffers. When we take the nurse away from the patient by having her, answer multiple siblings. So I encourage the use of technology. Set up a group chat.
Well, and
maybe
it also,
you're not on great relations,
and
but
it also
you can output the information.
Like it puts the resident or the patient in the middle of the family conflict.
Correct. And you don't want to do that.
And you don't want to do
this.
that. Exactly. So it's that's why for me I think it's like it takes a caregiver away, and then it also puts a person who is trying to heal and get better in a place where they're a mediator, they're a referee. And it's true. Not the place.
This is very true. Also, it's if I think about it from if I was the one not feeling well, and how much energy I wake up each morning, I'm draining my energy worrying about the family. What a gift if in that time, the family could agree that for the best interest of the one we all love, we're going to use this group chat.
Yes.
One person speaking and we're going to all use this group chat, get updates, and accept the update from the designated person. And let me tell you, it's hard being that designated person.
It is.
Take turns, if you want. But if you have someone who understands the medical terminology, sometimes they're more likely the person that will go to.
Right.
So agree to disagree, but use the communication. It is truly what's best for the patient in that time. And they don't have to spend precious energy worrying about people not getting along when they're, in the middle of a health crisis. And so those are some readiness that a family can take. It's almost like a fire drill, right?
Yeah.
None of us
I like that analogy.
Think about a house and a fire, but we have a drill. We actually have some equipment in the house, maybe a small fire that I attempt to put out, or we agreed we're going to go all outside, we're going to take important documents, and we're meeting here.
Right.
Now, you can practice fire drills. We do it in the healthcare setting. And the more we practice, the less emotion we take into that drill, and we just go through the motions.
Right.
This book is so valuable because as we get older, we don't just have one change in health.
I know.
Unfortunately, we tend to have multiple, and then 1, and then 2, and then 3. So as a family, getting in the groove, right? Have a plan for how you're going to communicate and practice that like a fire drill. That reduces the emotion. And as you're caring for and, supporting parents that are aging, over the years, those health issues will come. Sometimes they come faster, it can be more serious. And if you can separate those facts from the emotions, as a family, you move through a really trying time easier.
And I love that.
Yeah.
So again, I want to show you the cover of this book, and I want Cheryl to tell you where you can get it, because I do believe it is a must buy for anyone who is 40 or over, or if you have parents that are 60 plus. And I'm getting close to that, but I have to tell you, I am cognizant that this is what's next.
Yeah, that's true. Some of our older readers. So you can actually get prepared from Amazon.
Perfect.
It's available in digital format as well as in a large print edition. So those aunts and uncles or grandparents who are really hard to buy for, this is a great gift, for them as we come into the holiday season. It's a great gift anytime,
Mm-hmm.
but it's written in a way that they themselves can see themselves in the book. But again, the large print edition makes it just easier on the eye. So you can grab it on Amazon. If anyone wants more information or wanted to have contact with me, they can reach out to me. CherylField.com is my website. info@CherylField.com is my email address. And on the website, as supplemental content to the book, and you'll see this throughout the book, it'll refer you to the website.
Mm-hmm.
I have loads of links to resources for medication management, pain assessments, activities of daily living. You want to do advanced directives, it matters what state and what country you live in, but I've put links up to where you can easily find the right documents that you want to use. So my website is really just this plethora of extra resources for anyone who wants to go there, access it, it's all complimentary. So I'm really passionate about
amazing.
filling this gap, like we talked about the why.
Yeah.
This is the why on, at scale, being
Yes.
able to get these lessons that I've learned over my 35 plus years,
Mm-hmm.
seeing the systems from two perspectives,
Mhm.
and just really wanting to put that in the hands of everyone. And so that they don't go alone into that healthcare system and they really feel empowered. You talked about it, more control.
Mhm.
Don't go in feeling fear,
Mhm.
but go in feeling some confidence and some calm, because you have a system.
Mhm.
And maybe you have to just turn to page 47.
That's
Say,
right.
okay, here we are again. Go through that and do it every time, every day. It works. It really makes an impact on the outcomes of health.
Well, I am grateful that you wrote this book, and I have a copy. And
Without your encouragement, it wouldn't even be a book. So thank you. Thank you for that.
It's so necessary. Now, usually on my show, what we do is when we're ending, I ask all of my guests, what did you do to step into your life? So we're going to depart a little bit from the prepared, because you have had such an amazing career. You've had such an incredible impact in the profession of long-term care. And I also am just so in awe of you as a human being and a person. I really, really admire you.
Well, thank you.
Oh, I do.
I'm quite normal, I admit. So I thought a lot about this question. And actually, for me, a time of stepping in was actually stepping away. So I was in direct care 16, 17 years into my career. I had done some speaking at the national level. And as a result of working with a special interest group at the Association of Rehab Nurses, I had the fortune of getting a phone call from what became a future boss. Would I consider speaking on restorative nursing and in this one-day program? And so by saying yes and sort of stepping in, I actually became introduced to small clinical informatics types of roles where nurses were empowered to build and shape and design the kinds of software systems and electronic data systems that we've come to use every single day today in this industry. So my career took a change where I had that opportunity to move closer to supporting leaders in those roles. So I went from being a good nurse to being mentored to be a great nurse, and then becoming a leader in my space, and then teaching other nurses how to become great nurses and great leaders. And now I support those great leaders in the work that they do. So it's really about the scale. And in many ways, the stepping away from direct care, where I just loved and still do love, any opportunity I have to care for someone else is just such a gift. But I stepped into this part of my life where I could really get out of bed each morning and think, how can I make the role of a nurse better with technology? And that's the gift that I get to deliver. And sometimes it takes a few months to get it out. But that's what I get to do today. I design that. So by stepping out of direct care, I stepped into this life.
And I love it. And I know because I have used many of the systems that you help develop, and they help us give better care each and every day. So, and that's important.
Yeah, and those providers are so important. They're such important in the partnership. Without providers, without payers, patients are really stuck. And so I am so grateful for those folks like yourselves who owned and operated many of those organizations and institutions where us as individual people can really get great service. So thank you for that.
So thank you. And thank you for being on the show today. I really wanted to get this out here. It's also one of my missions and passions is caring for the elderly. And so this book to me is just such a big step for people, and I wanted to get it out there. So thank you for joining us today. I know today was a little bit more of a serious show, but it's something, again, that I feel so passionate about. Taking care of our elderly and sick in this nation and in the world, it's to me one of the most noble things that a person can do. And so Cheryl's given us a very good guide so that we can find the very best way to make that happen. So everyone, thank you again for joining with me today on Step Into Your Life, and let's journey together.